for the past few weeks, and in fact in past few days, we have seen the sharp rise in COVID cases in India. Currently, if we look at the total COVID numbers of the active COVID cases, it is getting close to about 50,000. Continuously the doctors are saying that there is a burden of influenza also in the hospitals, but how much of it is worrisome? To talk on this COVID and influenza, we have the former director of AIMS, Dr. Randeep Guleria. He is currently the director of internal medicine in Medanta. Thank you, Dr. Guleria, for taking out time and speaking to us. How do you look at the situation of influenza and COVID in the current context? How can one differentiate between these two? Because the symptoms are almost very similar.
Yes, you're right. The symptoms are very similar. They are classically what we call an influenza-like illness. That is, there is fever, cough, sore throat, body aches, followed by sneezing. And that is what we see in many patients. Currently, this can happen both with influenza and with COVID. And to really say that this is influenza-related fever and this is COVID-related fever is clinically difficult, or I don't think one could really differentiate between the two. So we are seeing an increase in number of COVID cases and influenza cases, which does happen during this time of the year when the weather is changing. And this has also been seen in the past as part of the influenza surveillance network, that during change of season, there is an increase in the number of influenza cases. The good thing is that although the number of cases has increased, both COVID and influenza, the hospitalization in terms of severe pneumonia has really not gone up significantly. It has gone up as what we see every year, but we are not seeing a huge surge in the number of patients coming with COVID or influenza pneumonia, requiring oxygenation, requiring ventilation. Admissions that are happening in COVID positive are predominantly those who have comorbidities and there is worsening of their comorbidities because of COVID, or sometimes the elderly who are frail and because of COVID have now become more sick. They are the type of patients who are getting admitted. I personally feel that the number of cases are more than what is being reported, because a large number of people who have flu-like illness don't get themselves tested and they just treat it as an ordinary flu. And therefore, even if they get tested and do what we call a rapid antigen test, they don't upload the data. Therefore, there may be more cases in the community, but by and large, it's a mild illness, a flu-like illness only.
Sir, how do you see the burden of influenza in the hospitals? Because you are treating the patients also. And pan-India scenario, if you can talk about what is the situation right now? Because in COVID, we are seeing large jump is there. But what is happening in influenza, and how is it affecting the elderly as well as the children, if you can talk about that?
So I think influenza also there will be an increase in cases. But like testing is frequently done and easily done for COVID, probably that is not done that much as far as influenza is concerned. A lot of people don't get themselves tested for influenza. The number of labs are also not that many as for COVID, and therefore probably influenza gets missed unless you really test it, and therefore there is likely to be also a number of cases of influenza. But what is good is that if you look at what we call SARI, that is severe acute respiratory infection, that is the patients who come to the hospital with severe infection. That number has not jumped very dramatically, and therefore hospitalizations are occurring because of influenza also. We are seeing both influenza A, influenza B positivity in patients who are coming, but it's not a very large number, and most of them are those who are elderly or those who have comorbidities.
If we talk about the vaccines, we have seen the advocacy of COVID vaccines a lot. But if we talk about influenza, we have seen the flu shots. And in fact, we were in Medanta and we saw the advertisement of flu shots. What is happening, and how, if you can tell us some details about flu shots and who can take it and who should actually take it? Should it be the children or the elderly? Who should be given those flu shots, sir?
So influenza vaccine is an annual vaccine that has been available for now many years, and anyone over the age of children over the age of 6 months can take the shot. It is a quadrivalent vaccine. That means it covers 4 strains, 2 influenza A and 2 influenza B strains. The influenza A strain that it covers are the swine flu origin strain, the H1N1 strain, and the H3N2 strain, which is also now circulating more and causing more influenza, and also 2 influenza B strain. The vaccine is given by WHO to manufacturers depending on the data that they collect in terms of surveillance, and that data is also given by India as to what are the circulating influenza viruses in India, and based on that, the vaccine is made. It's an annual vaccine, and I would say that especially young children, the elderly, and those with comorbidities, they should definitely get themselves vaccinated. Otherwise, the US actually advocates that everyone should be vaccinated with COVID. But I would say at least the high risk group, those with comorbidities, the elderly, young children, and even pregnant women should get themselves vaccinated because it helps them in getting less severe disease and therefore protects them.
Dr. Guleria, we have seen the children not getting vaccinated against COVID, and at that time, when you are advocating for a flu vaccine shot for children, how critical it is for the children, and how do you see the hospitalization rate in influenza in the current scenario that you're seeing right now?
So I think for children also it's important to get vaccinated, whether it's COVID or influenza. It protects them from severe infection, but more importantly also it protects them from carrying the infection. So they are less infectious. Very often children may have a mild infection, but if they get the infection from school, they carry it to their home and then they give it to the elderly, the grandparents, or someone with comorbid condition who can have a more severe infection. Therefore, vaccinating the children not only to protect themselves but to also try and break the chain of transmission is a useful strategy. I would say that we are seeing admissions in children also to some extent, but it's not that there is a huge surge in number of patients coming with influenza or COVID. And we've always seen that as far as COVID is concerned, by and large, children are a little bit protected as compared to adults in terms of getting more severe infection.
Dr. Guleria, if we talk about the current context of COVID in India, today we saw 10,000 cases after 8 months now. How do you look at the current situation of COVID? Because the cases are mounting up and this is significant testing happening only in people who are symptomatic. So how do you see these numbers going up? Till when we can see the numbers going up, and probably we will see the saturation of cases?
So COVID is here to stay. The virus is not going to go away. It will continue to mutate, and it will mutate to become more infectious and be able to have immune escape mechanism. So we will see some degree of COVID cases even in the coming months, and there will be small waves that we will see off and on. Gradually it will have what we call a seasonality, that you will see more COVID during change of season, during monsoon, and maybe during the winter months, and then it will come down. But this was something that happens with all respiratory viruses, that they will develop some sort of a seasonality and they will have some degree of small waves. As long as we don't see a huge surge in the number of admissions, or the virus does not mutate to become more virulent and cause severe infection, I think we should not get worried. We should just have a good surveillance so that we are able to pick up any new variant and be able to see how is that variant behaving in terms of the type of infection, in terms of the severity of infection, in terms of hospitalization. If it is causing a mild infection and it's something that is not really leading to more hospitalization, that will happen as we are seeing with influenza, and I don't think that is a great cause of concern. What we're also seeing is that this virus will stay, and from a pandemic virus will become an endemic virus, where it will continue to have some degree of ups and downs and cases throughout the year, with waves coming up during the change of the weather.
Dr. Guleria, we saw the Covovax getting introduced into the vaccination program. In fact, the Serum Institute's CEO said that it is effective against Omicron and XBB. How do you think the vaccine, which has been made on the wild variant, the initial form of the virus is mutating? Do you think that there is a need for a bivalent vaccine, or the entire vaccine mechanism needs a complete rejigging? How do you look at that?
So as the virus evolves, we will have to evolve our strategy. And I would say that we already have a bivalent vaccine in the West, both in Europe and the US. India should also start looking at what we should do to be ahead of the curve in terms of being able to develop vaccine which are dealing with new variants or possible emerging variants, rather than the older strain, the Wuhan strain, against which the vaccine actually has been made. So I think although the vaccine may be effective, the efficacy of the vaccine may have come down significantly as compared to what it was with the original Wuhan strain when we look at the Omicron strain and the sublineages of Omicron that we're seeing right now. Therefore, I think we should try and do two things. One is collect data to see what is the efficacy of the current vaccine against these new variants, and also develop new vaccines which are able to cover the emerging and the new variants which are circulating and have become the dominant circulating variant, so that we are in a position to be able to have good vaccines available. If the virus suddenly shows a surge in the number of cases, we are prepared in terms of new vaccines.
So you talked about the endemic stage of the pandemic. Yesterday, the health ministry also said that the cases will continue to mount for about next 8 to 10 days, and it is in endemic stage. Do you think that currently COVID in India is in endemic stage and the state of worry should not be there?
So I think we have moved into an endemic stage where COVID has now is there to stay, and we will have these small waves coming and going now in the future, and we need not worry about the type of situation that we were seeing in the last 2 years for two or three reasons. One is that we have now good amount of immunity both because of vaccine and because of natural infection. So hybrid immunity is good, and therefore as a population we are better prepared to fight against the new virus as compared to what we were when this virus came out as a new virus to which we had no immunity. Secondly, the virus also has evolved, and if you see over the last more than 1 year now, there is only sublineages of Omicron which have come. We had Alpha, Delta, Beta, and new strains kept coming one after the other, new variants kept coming one after the other, which were very different with multiple mutations. Now this seems to have stabilized, and what we are seeing is sublineages of Omicron. Keeping these two things in mind, it seems that we have reached an endemic stage where we will continue to have cases, some admissions, but not a situation that we were seeing in the last 2 years.
So when do you see the cases coming down in India? Because we are currently seeing the upward trajectory.
So my own feeling is that in the next 2 weeks or so, once the summer weather changes, it becomes hot, and we cross that incubation period of transmission, we should be able to see a decline in cases. So possibly after about 2 weeks or so, the cases should come down.
So that was Dr. Randeep Guleria clearly mentioning that next 2 weeks we are definitely going to see the numbers stabilizing or rather coming down of COVID. With video journalist Nitin, this is Ayushman Kumar for Moneycontrol. For more such news and videos, do subscribe and follow Moneycontrol.